Hello, my people. It's Naija Health Doctor. Welcome to my podcast. On this podcast, we'll be discussing about how to have a good and sound health. Additionally, we'll be bringing different professionals to give us tips on how to maintain our health. Maybe you're young, you're old, you will still benefit from this program. And I'll be your host. Here with me, I have a physiologist. You will learn a lot from him today. Here is my guest. Good morning, sir.
Thank you so much, Dr. Sonny. I'm thrilled to be part of this. Thanks for having this, and thanks for having me.
Thank you, sir.
My name is Johnson Babajide Oduyomi. I'm a physiologist, volunteer, and a researcher. Thanks for having me on this show.
Thank you very much, sir. Like, we have different questions that we would like to ask you because our viewers out there want to know. Like, why do you choose to be a physiologist?
As a physiologist, we study body function,
Yes.
the adaptation with different kind of environmental changes, such as exercise, diet, stress, chronic conditions, different health conditions. I actually am fascinated by the cause. I am fascinated by how little changes we do in our lifestyle affect our body health as a whole. So I've never regretted studying physiology.
Well, I love what I do too. Yeah. What are the mistakes that people make when they're thinking of fitness?
That's a very good question, Dr. Sonny. So I feel people go too fast and hard when they go into fitness journey, and they get worn out of exercise. Like they do habits in which they can't actually cope with.
Yeah, they want it now.
They want it now. They are so quick. Like they just want the changes rather than being consistent. People do like 1 week.
They turn exercise to stress.
And they should not forget that the goal is consistency, not actually.
Yeah, even if it is 5 minutes every day,
it actually amounts to something.
Than to do
something that you can understand in a long period of time.
Just like someone is doing like 1 hour in a day, and once you do Monday, you wait till Saturday before you do another one. Yeah, you will not see the effect.
Why not do maybe 20 minutes every day?
I like that. What are the friendly exercise that someone can start with?
What I believe is exercise should not be costly and should be easy. All these are joints and bone exercises that we can do that are actually friendly. We can start from walking. Walking is very simple and friendly. It works on our joints. It doesn't have much effect on our joints. I can recommend swimming also. Swimming also has a effect on our cardiorespiratory and our joints, muscles. Then people that like cycling. Exercise is something that you can enjoy too. As an hobby, some people cycle and it's a form of exercise too. So,
wow, I love that. The exercise we're talking about, like what time do you prefer to do your own exercise, or what time do you want to tell our viewers to go for an exercise? Is it in the morning or in the evening?
I think the best time for exercise is in the morning. It might actually vary depending on kind of work. Most times we are in Nigeria now, people go to work as early as 8.
Especially if you stay in Lagos, you go from very early, 5 o'clock and stuff.
So, and sometimes you are even tired when you are coming from work. You don't have time to do exercise in the evening. But as a remote worker, if you are working from home, you can actually do your exercise in the evening, or you can have a early morning jog or anything if you are not doing normal 9 to 5. But if you are doing normal 9 to 5, something you can still do and just shower and go to work. If we are staying somewhere like Ibadan, we are not staying in the Lagos part. But the best time for exercise is actually in the morning when the sun is not yet out and you are not yet stressed.
I love your answer. And for people that have chronic pain, like what are the exercise they can do? And because a lot of people believe that you need to somersault before you achieve what you want to achieve. Do you need all the strength? And you understand what I'm saying?
Oh, thank you. That's a great question. For people with chronic pain, it depends on the source or the cause
of the pain,
of the illness or pain they are having. And the best person in place to recommend exercise for them is the medical practitioner. They have the history.
Yeah, that know the history of the health and everything.
So they'll be able to give them recommendation on the kind of exercise that they can do. But on the plain ground, they can start with walking, yoga, sheer exercise, and others. It can actually help them improve their health.
Wow, it will help the mobility.
Yes.
Wow. What's the difference between like stress and exercise? Because we used to have some people, they will be like, since morning I'm a bricklayer, I've been working since morning, I'm a carpenter, I've been working since morning till this time around, and you expect me to now start exercise again. We do exercise on a daily basis. What do you have to say about that?
Thanks so much. That's a very great question, Dr. Sonny. I would like to establish that there is a very thin line between stress and exercise. As our body, we sense many things through our body. Our nerves, our neurons, afferent neurons take some signals to our brain to sense it. You can't, because you don't have teeth here, you are walking down the road instead of you taking bike. Your body interprets it as stress. Exercise is something you do, like conceive it first. Okay, I just want to do this exercise. It's not because I don't have money. So that's the way the body interprets it. When you walk down here to a very far distance because you don't have money, you will end up having a headache. But when you do jogging or you exercise, the least you have is like maybe some soreness, and you feel even light and relief. So people actually mistaking it a lot. Whether you do a work that you have to dig the hole every time for your money, you know why you are doing it. It's not like you love doing it. But when it comes to exercise, something you enjoy doing, or you actually committed, like, I want to do this thing.
Our viewers will understand it that now it's not like you will trek like 3 hours, you will say you are doing exercise, you are stressing yourself. I used to hear it that people will say, they have big tummy, they want to do exercise, some people will even be jumping that the tummy will be going up because they want the tummy to go down. Now. What can we say about those people?
When it comes to tummy fat and weight losing generally, it's not only about exercise. Many things come to play. Your diet, and particularly the time you take your diet. Not to spoil the market for people selling tummy fat reduction stuff or pills.
Yeah.
But most times when you eat late at the night, you surely have developed a big tummy at the end of the day.
Yeah,
so why you don't consider your diet? There's no exercise you want to do. At the end of the day,
the results will not come.
You are the one eating chocolate at 1 a.m. in the night. You are the one snacking up.
I know some people that
even
3 a.m.
Make ever around 2 o'clock. Yes. And you still want the tummy fat to go down. You now keep eating the gym and there's no changes.
No, they will say this is how we used to eat it in our house.
Or they will buy one cream, buy everything to rub on it. That's not it. Little things actually matter. It contributes to your lifestyle.
It's lifestyle.
It's little drops that make oceans.
A lot of people want their tummy to be fat and they cannot control their eating habits.
Yes. What they don't know is like they actually start somewhere when they have this bad eating habit. They can actually start somewhere also to correct it.
To cut it down.
So it's just something you do regularly, day by day, it turns to an habit.
Yeah. So it will not be difficult for them to stop it. Some people, if you ask them that after 7 you cannot eat again, they will faint more than 100 times before the second morning.
Yes.
They will faint because they will be seeing masquerade, seeing different things because they are used to that lifestyle.
Yes, because our body will have to process it again and adapt to it. Just like when you start exercise, your body will feel like it's a very strange thing. The first day after exercise, it will be a second day is painful. But the moment you keep doing it every day, your body gets used
to it. It's
just like training a child how to walk or how to do something. The starting process will be hard, but with consistency, that's one thing that I'm very big on. With consistency, do something that are little and consistent, you get to
achieve it. Okay. So lifestyle, they need to check their lifestyle before thinking of bringing down the tummy fat.
Some even have sedentary lifestyle that they sit almost all the day. They don't even stretch.
As if you know what I was to say. Like we have a lot of people, like in the market, you see them sitting from morning to evening. They don't do any exercise. And they will eat morning food, eat afternoon food, even evening too. They will eat it.
Went for an outreach around Bodija market that time. This woman has a BMI of almost 45 or 55. And when I asked her about her occupation, like what she does every day, she takes the same bike from her house to work, and she has to sit down and sell her goods at the same spot, same thing. She take another bike
to come and carry it.
I advise the woman, why not stop at the junction of your house
and trek a
little bit home. When you are coming in the morning, stroll to the junction before you take bike.
Wow.
Do you understand? Those little habits are exercise forms, And sometimes don't just feel relaxed sitting every time. You can walk through the market.
Even in your room self.
Yes, you can walk, you can stroll while you are making calls, you can do many things.
Yeah, just to back your point, a woman was telling me something. He said, in this market, as you're seeing this market, 90% of people selling in this market take pill before they sleep at night because they are always on sitting. They don't do any exercise because they are busy. Monday to Saturday, Sunday too, they will still go to church or mosque. So they should stand up and stroll.
Especially most people, even office workers, people that are bankers,
they need to sit and
all day long and everything. Profession that you have to sit most times in a day. Sometimes just take a little stretches, walk down, your break time, use it to stretch, not sit down and still eat again.
I like that. What are the fitness myths that you've heard before that you know that this thing is just a mythology?
One that actually stick with me a lot is if women do stress exercise, they will get bulky. Actually, that's not true at all.
Okay.
Because we all need this stress exercise for our cardiorespiratory
fitness.
It improves the way blood flow in our body, our heart pump blood. There will be freeness,
helping the oxygen to flow very well.
So it's not actually right that when you take exercise, they become bulky. It's not everything that is about muscle building. So some of the exercises are not about muscle. They're about to even give you good life, good health. You don't have to have 6 packs.
Yeah.
To be healthy.
Yeah, I like that. On a short note, what are the tips that you want to give our people that is watching us? Just to round it up, because the time is running. I know you're going to a lot of places.
Yes. When it comes to cardio, fitness, or exercise, you don't have to start hard. Start little. I recommend walking, walk within some miles, jog. There's something we call habitual stacking.
Okay.
It's an habit you do, but add something to it. You can squat where you brush your teeth. If you do it every day, you know that whenever I'm brushing my teeth, I'm squatting. When you are making phone calls around the house, you can walk through the compound. You know that when I'm making calls, I'm working at the same time. Maybe you are frequent in taking calls a lot, so you can keep walking and taking calls. So those kind of things
will help
you. Or you can keep riding a stationary bicycle or something while taking. You can try to ride your bicycle maybe with your kids or anything on a Sunday. You can play football in the house, just something fun. It doesn't have to be so hard. You don't have to work up 9 hours in a day. Just little.
The other time you were talking about breakfast. That is very, very important.
Yes, very, very important. Breakfast should not exceed 10 o'clock. You can skip other meals as far as I'm concerned health-wise, but breakfast is very important. You must eat before 10. Some people feel like, oh, I don't actually feel the hungry in the morning or anything. That's why it's called breakfast. You're already fasting throughout the night.
Yeah, so
even if it's water or milk is a complete diet. So if you take milk, make some tea and take it. So it's actually healthy, other than leaving your stomach empty. So just have to take something early morning. Then when you're hungry, you can take more.
Wow.
But skipping breakfast actually has a lot of disadvantage
in our body.
Yes. Let me note one scenario. We went for an outreach also in Bodija at that time. The woman, when we checked her fasting blood sugar, she's just like a walking cup. So she told me she don't eat until like 12 and she walks around the market.
Seriously?
You imagine the kind of stress she's going through. She walks around the market and she don't eat until like 12 every day.
Hi.
She was so underweight and she doesn't feel it. The only thing she takes is all this cold drink, Coke and everything when she's very hungry. So breakfast should not exceed 9 to 10. 10. Take breakfast. Even if you are not hungry, take breakfast.
Wow. Because of our time, I know you have a lot of things to. He has a lot of things to tell us.
I enjoy talking about health.
Yeah, it's very, very nice. But because of our time, we would like to bring you another time, and I'm very sure that you would like to come.
Yes, any opportunity I have to tell people about their health, their lifestyle, they can improve their health. That's been one of my biggest passion. On even researching more about how people can improve their health.
Wow. Thank you very much. We really appreciate you for coming to this program. My people, I said it earlier. I said this season you will enjoy it. Thank you very much for joining us. Make sure you subscribe, like it, share, and comment for people. Share it for people that will share it for another people. Thank you very much. See you another day.